Good morning, colleagues. My name is Rashid Taufi. I'm the Deputy Director General in the Department of Economic Development and Tourism, and it's my absolute pleasure to welcome you all here today. Today was intended to be our moment when we wanted to launch our Tourism Reignite program, and as you've all seen, much has changed over the last 72 hours, and I think we felt it's still really important to address you today, to have a moment to engage with you, provide you with an update, and to also hear your views. So I'd like to welcome the Minister, David Maynier, for Tourism, for Finance and Economic Opportunities, and I shall introduce the rest of my panel shortly. So, or the rest of the guests here today. But thank you all. I see many guests and colleagues and friends from all of our industry partners. Colleagues Glenton from Saki, and I'm sure all of your members, Fedhasa, Rima, welcome everybody, SATSA members, Westgrow board members, and our chair, Mike Spicer, welcome. Cape Town tourism members, thank you all for being here today. I remember addressing you all, I think we were still doing face-to-face meetings in the Taj in March 2020 when we knew COVID was happening, and here we are at the umpteenth briefing. With a different set of changes happening to our tourism sector. So welcome everybody. Rihanna, if you could just share the program briefly, I shall just outline before I hand over to our first speaker the program for today. So our first input will be from Minister David Maynier, and I will segue into that shortly. Thereafter, we'll get a health update from colleagues from our Department of Health, Professor Mary-Ann Davies and Dr. Melvin Moodley. And then Paul van der Brink, some of you might know him. He's our colleague who heads up who really is the person who makes our air access program happen. And we'll get a very up-to-date and probably changing, but update of where we stand on air access, which airlines are flying, which are not. And then there'll be sufficient time for us to have some questions and answers. But we'd like to see this all completed in an hour as a very tight and sharp briefing. So thanks, Rihanna. So Minister David Maynier doesn't need any introductions, but I wanted to tell you this past weekend was incredible. I saw a different side of Minister Maynier. We literally spent many nights at the airport, and Minister Maynier, along with various consul generals, was literally the last man standing at the airport, waiting until every single client, every single customer was either on a plane or had clear information around what their options were. So down to midnight on Saturday night, booking the last few Belgian people into a hotel, getting them into an Uber, and then following up on Sunday night and making sure they were back and on the plane. So Minister, it was incredible. I know you have many things on your mind. You're also our finance minister preparing budgets, but to see you out there hands-on was really reassuring. And I think a lot of passengers and visitors to Cape Town saw an amazing team effort from colleagues from AXA, Cape Town Tourism, and the full team effort of really being hands-on. So Minister, I'm going to hand over to you for your address and briefing to the industry. Thank you very much.
Thank you, Rashid, and thank you for that those very complimentary opening remarks. I want to start by welcoming particularly the panelists, Mr. Solly Fourie from the department, Dr. Melvin Moodley from the Department of Health, Professor Mary-Ann Davies also from the Department of Health, and Paul van den Brink from Westgrow. I really want to extend a very warm welcome to our now over 100 participants from the tourism and hospitality sector here in the Western Cape. I want to start off by saying that we as a team are keenly aware that the latest developments have been a blow to the tourism and hospitality sector, with cancellations, with loss of revenue, putting the recovery of your businesses in question. And of course, with many businesses in the industry now considering furloughing or possibly even retrenching staff, which of course is a terrible setback for our tourism and hospitality sector here in the Western Cape. I want to assure you that we are doing everything as a team to support you. I am coordinating our response with the departments and entities, meeting daily, focused, at least in the first instance and over the last 3 days, on assisting our stranded passengers. And we have built an incredible partnership between the Western Cape government, the City of Cape Town, AXA, Westgrow, Cape Town Tourism, the consul generals, the airlines, and of course the industry associations who have stepped up and assisted the stranded passengers at the Cape Town International Airport. We are also working around the clocks, often behind the scenes, on seeing what can be done to remove South Africa from the red list and the various travel bans, and of course opposing any further lockdown measures that would negatively affect the industry. I really want to assure the industry that in Premier Alan Wendy is certainly a very strong voice, possibly the strongest voice, advocating for keeping the economy open and ensuring that lockdown measures are not imposed on the tourism and hospitality sector in the PCC, which, as you know, is the key intergovernmental decision-making body on lockdown regulations in our country. We also are looking at pivoting and adapting our destination marketing campaigns, and we are looking at what we can do to further support, to put measures in place to support the tourism and hospitality sector here in the Western Cape. And it's precisely because of this that we decided to convene this webinar. For us, in the first instance, to provide you with an update on our response, but also to provide you, the participants, with a platform to get reliable information from experts like Dr. Melvin Moodley, like Professor Mary Ann Davies, and of course, like Paul van den Brink. Also provide you with an opportunity to put questions to experts. But most importantly, also, it's an opportunity for us to listen to your concerns, to listen to your proposals about what you think we could be doing, that we are possibly not doing, to support the tourism and hospitality sector in the Western Cape. So I certainly look forward to this webinar and extend a very warm welcome to our now 129 participants from the tourism and hospitality sector in the Western Cape. Thank you.
Thank you very much, Minister. I appreciate that. And I'm sure we'll engage and hear more of your inputs a little bit later. So I just want to, as always, by now everybody knows the format. Please use the chat to engage with each other. But if you have a specific question, please add it into the Q&A box. And we have some more of our colleagues, Ilse van Schalkwijk, our Chief Director at DDET, and Monica Earle, the Chief Marketing Officer at Westgrow, who will also be answering your questions, providing any access to resources that you might need. The really important thing that I've seen in the last 72 hours or 3 or 4 days has been making sure everybody has the right information and is on point and has the latest information. So we will assist and make sure that's the least we can do, is keep you all on the same page. So it's my honor now to introduce you to our first speaker, Prof. Mary Ann Davies. Welcome, Prof. You're welcome to share screen, but welcome. Thank you very much for being here. Prof is the public health medicine specialist, and she's responsible for epidemiology in the Western Cape government. So, Prof, thank you very much for being here. Over to you for your input.
Thanks very much. If I can just confirm that you can see my screen.
Absolutely,
Great.
We've got it. Thank you.
Fantastic. Thanks very much for inviting me, and acknowledge that the bad news that we received last week was really difficult news for all of us. And so I've become often the bearer of bad news over the last 2 years. But I think the one thing that I hope I can provide today is a little bit more certainty, or a little bit of a boundary around the uncertainty, although of course we are in a very rapidly changing situation as we figure out more about Omicron. So I'm going to start off with just an epidemiological update for the country initially, and then the Western Cape specifically, and then talk about what is emerging about Omicron. I'm not going to repeat what Tulio de Oliveira and Richard Lessels explained very well last week, but just talk a little bit about the additional information that we have learned since then. So as you can see on the left-hand side, this is data updated regularly by the South African COVID Modelling Consortium, which essentially tracks the number of cases on a log scale. And they classify provinces as being in a sustained increase once they've met particular criteria. And you can see that all provinces, except for the Free State and the Northern Cape, are now in the situation of a sustained increase. The definition of the start of an actual wave is somewhat arbitrary. And so what's more important to monitor is the trend in terms of the direction of cases. And we certainly are seeing that trend. And the graph on the top right in absolute number of cases shows that that's being dominated by Gauteng just because they're a bigger province. But we are seeing increases across all our provinces. What is a little bit concerning in Gauteng is that we have also seen quite a steep increase in the number of admissions in the last 3 weeks. We always think cases don't necessarily translate into admissions, and we are hoping that with our very high levels of prior infection and our vaccine coverage, particularly in the Western Cape, where our vaccine coverage is generally better than other provinces, and Dr. Moodley will speak to that later, that we may be protected from the automatic translation of cases into admissions. But we certainly have seen an increase in Gauteng, and in a sense, we're fortunate that they're running ahead of us, and so we can watch what is happening there in order to guide our response. I would note, however, that the absolute numbers are still relatively low compared to previous peaks. And so while the percentage increase is huge because we're starting from a low base, the numbers are still relatively small. Moving now to the Western Cape, what we're looking at the top is the number of new cases per day, and the blue line is the 7-day moving average of new cases. And you can see that since about mid-November, that started increasing quite steeply, so that we now have about 100 new diagnoses each day. On the bottom left is the proportion of tests that are positive, which is one of our most sensitive indicators of a surge. And you can see that this has climbed from sitting at around 2% up to about 4%. In terms of admissions, new admissions to hospital, we aren't seeing much and the numbers are very low, but we have since about the 21st of November just seen a change in the downward trend. So we're watching that very closely, and mortality is obviously very late, and so we haven't seen any change. What I would like to note is that all these numbers are as low as they have been in our interwave period. So we're seeing signs of an increase, but we're coming off an incredibly low base. So although the increases seem steep, because when you've only got 100 cases, you only need 20 more to get a 20% increase, we are dealing with relatively low absolute numbers, but the speed of the increase is concerning. If we just look across our districts in the metro, the increase is being dominated by Klipfontein, Northern, Western, and Southern, and Tygerberg. So generally areas with a lot more private sector testing, but Klipfontein as well. And we obviously do need to watch this closely. It's going to be very interesting to see what happens in Khayelitsha, which is an area with very high prior rates of infection, to see how much protection there is. And then if we look across the province, realizing that many of you come from areas that are tourist areas outside of Cape Town, we've seen not as dramatic increases and more driven by clusters of cases, particularly in the Garden Route and Cape Winelands. But we also know that often things start in the metro and then move to the other areas. One of the things that we've tracked to sort of identify when there's a turn is something called the percentage change in the average of new cases over a week. So in other words, if there were 100 new cases per day last week, how many new cases per day are there this week, and what's the percentage change? So here the blue line shows the absolute number of cases, and the yellow is the percentage change. And you can see how that kind of flips at the start of the wave. And we officially term ourselves in resurgence when that the percentage change has been in excess of 20%. But as I've said, when you're coming off a very low base, it's very easy to meet that mark. So if you go onto our public-facing dashboard, you'll see that we are officially in resurgence, but we do need to bear in mind that we are coming off this low base. So our kind of panic levels need to be tempered by the fact that the numbers are so small. What is probably more concerning is the speed of the increase. So what we're looking at here is something called the reproductive number, which is the average number of people that each infected person will pass the disease on to. So if that is greater than 1, then each infected person is passing the disease on to more than one other person, and that means the epidemic is expanding. So we always try to keep it below 1, and it had been very comfortably below 1 until about mid-November, and it's now soared up to 1.75 nearly, and that's actually almost the highest level we've had during this entire pandemic. And matching that on the right-hand side is what we call the doubling time, which is the number of days it takes for the number of new diagnoses per day to double. And you can see that that's dropped from about 25 cases per day down to about 7 cases per day, and is forecast to remain low. These are publicly available forecasts for the number of new cases in the next week. So what we do here is the black line is the number of cases in the previous week. The gray line is what was predicted for last week, and the black dots is what actually happened. And then the red line is the future prediction, taking into account what went wrong with last week's prediction. And you can see that for the Western Cape here at the bottom, the last week's prediction was much higher than the forecast. And so that means for this week, they are predicting this extraordinarily high number of cases. One of the main reasons to show this graph is that I actually think it's excessive. I haven't engaged with the modelers myself since seeing this, but I do think these numbers are a sort of 10-fold increase is probably too high. We're seeing at the moment about a doubling in week-on-week cases. So I think we just need to watch that very closely. So moving to Omicron, what do we know? And unfortunately, there are a lot of question marks, but I think the things that we can hang on to are the things that there is certainty about. So does it spread more quickly than Delta? We're not sure yet. It's probably about as transmissible as Delta, maybe slightly more, maybe slightly less. The most important thing, I think, is do the vaccines still work against severe disease? Not against infection, because we know that the vaccines are not 100% effective against infection, but do they still work against severe disease? There's been very, very early analyses done, and it's early days to say anything, but at the moment, we're not seeing any loss in protection of vaccines against severe disease. And the mutation profile and the type of immunity that the vaccines provide suggest that protection against severe disease should be maintained. And that really makes a big difference. And I think as soon as we can do robust analyses to show that, the sooner we can argue for particularly the international community to open up, because if the vaccines work, then we are all protected. Diagnostic tests still appear to work. The other big question is, does this cause more severe disease? At the moment, there's no early signal to suggest that it does. We will be looking at that closely. Again, if we can show that it causes less severe disease, that will also provide reassurance. And so that is one of our urgent analyses. And then I think the one piece of evidence that is emerging and which is of relevance in South Africa is that it does seem that this variant may be able to infect people who have had previous infections more than variants before. So in other words, if you've had a previous episode of COVID, the chance of being protected against this variant is lower than with previous variants. And this is obviously a concern because our population seroprevalence, or our population level of prior infection, has been a major protective factor in previous waves. That's why I said we're going to watch Khayelitsha very closely. But even if one can still get infected with prior infection, what's really important is whether the protection of prior infection versus severe disease is maintained. Because if people just get infected and they have a sniffle and it's not too bad, that's actually not the worst thing in the world, because probably that infection will boost their immunity and protect them against the next wave. If they can get severe disease a second time, then we need to be concerned. And so that's, again, one of the key analyses that we are working to try to unravel. This is no longer relevant, but this is a model that was produced by the Modeling Consortium. It's available publicly on their website to show how bad a fourth wave could be in the Western Cape if we had a variant that could escape immunity by 25%. In other words, if your chance of being infected was 25% higher than previous variants, even if you'd had prior infection. And what they showed, this is looking, the blue is at numbers of admissions that are expected. You can see the previous waves, the blue number of admissions that were expected and the number that actually happened. And they predicted a fairly small fourth wave. The reason for the double bump is because they just predicted whether this would start in November or January. I think what's useful about this is it gives us some idea of a fourth wave, but if this variant is able to escape more than 25%, so let's say it can escape 50%, then we would expect a substantially larger wave than this. And so I think they will be working on updated trajectories because of this concern around the immune escape. And obviously, if it's more transmissible, we could expect something bigger than this. And the other thing just to note is that their model assumed that vaccine protection against severe disease was maintained. So as soon as we know whether that is the case or not, that will help us to update the models. And they also assumed 75% vaccine coverage in those over 60 by March of next year. And unfortunately, it doesn't look like we will reach that target, but Melvin will provide more detail on that. Finally, is Omicron in the Western Cape? Yes, it most certainly is. So over the weekend, a number of samples from Pretoria were tested, and they had what is a proxy marker for the test that you can actually detect on the PCR test itself without having to do genome sequencing. That's 18 out of 22 of their samples. And then Tygerberg has also done sequencing, and then 15 out of 20 of their specimens had Omicron, and that included private sector specimens as well. And we had a marker for Delta that we used before, which is shown in the orange, and you can see that the proportion of Delta actually started decreasing in October, and particularly at the beginning of November. So we think it's probably been around since early November. And then finally, where else is Omicron? And I think this is very important because this tells us how much should other countries be worried about South Africa as opposed to be worried about their own domestic situations. So there are now 205 confirmed cases in 18 different countries in the world, and about 1,300 probable cases. So these are usually going to be people with travel history who have the PCR proxy. And actually, because of the PCR proxy, it's going to be quite easy for people to find this all over the world. What is of note is that in Germany and Scotland, it was reported yesterday that there are cases in people who have not had a travel history, which suggests that the variant is circulating in those countries already, and not only in travelers. And while I don't want to wish bad things on any other country in terms of lifting travel restrictions, in some ways, the sooner that this variant is found to be circulating in other countries, the easier it will be to get those travel restrictions lifted, because it will demonstrate that those are not going to help with containment. And I think that's all I have, and we'll hand over to Dr. Moodley.
Thank you very much, Prof. That was fantastic, very insightful. And Dr. Melvin Moodley heads up strategy and is really our go-to person. Melvin, thank you for always being here to speak with us so that we're aware of that important interface between, the stats and the epidemiology and how it impacts on business. So I love Melvin's perspective because he has been very much operational, previously the Chief Executive Officer of a hospital, a large hospital in the Western Cape, but now at HQ. So Melvin, over to you for a brief addition to that presentation.
Yeah, Rashid, thank you very much. I am actually going to be very brief. I'm going to just check if you can see my slides. Okay, and to all the participants, there's a lot of data on these slides. I will make them available to you and you can go through them at your leisure. I'm going to cover 4 slides that I think are pertinent to our discussion. So Marianne has covered the epidemiology and some of the characteristics of our Omicron. I'm going to talk about our most effective tool, which is vaccinations. So as we stand right now, vaccinations in the country and in the Western Cape, then the measurement I'm using is fully vaccinated. You may hear the term vaccinated, and that does not necessarily imply fully vaccinated. So for the country, we are 35.78% fully vaccinated in the adult population. In the Western Cape, it's 42.52%. In the Western Cape, we've given 4 million vaccines, and in the last 24 hours, we've given 21,143 vaccines. So that just gives us the basic idea. If we look at, and I'm going to go through my slides a little bit quickly, if we look at vaccine coverage, fully vaccinated at 29th November for the over 50 cohort, you can see that for the province, we are at 59.2%. Now we want to be at 85% here. This is the group that is most likely to be hospitalized or die from COVID-19. And we would like to be much higher than we are. Now, some areas are quite good. Overberg's quite good. So is Garden Route. And I know there's some callers from the Garden Route here. And then we see that in Central Karoo, it's lower. And we've noticed that there's more hesitancy in the Central Karoo area compared to other districts. Now, our target for the 18 to 49 group or 20 to 49 group is at least 1 dose, and we want to be 65%. And here we see that for the province, we are only at 45% with lower numbers in the Central Karoo and the West Coast. So here's an area we really do need to increase vaccinations. In these 2 slides, in the next 2 slides, I've split it between insured and uninsured. And if you look at the 20 to 49 cohort, the amount of at least 1 vaccination is actually a little bit higher in the uninsured. And I'm going to put forward a theory here. If you look at the insured group in the 20 to 49, there should be no barriers to access. These people should have transport, they should have the money to get to a vaccine site, there are enough vaccine sites and there's enough vaccinations. This means that there is another reason for this hesitancy, possibly feeling less threatened by COVID-19. And this is a group that we definitely need to target. And one of the areas could be in workplaces, and another method, of course, could be mandatory vaccines. Of course, we also need to target this group. In this group, it's really interesting. This is the over 50 group, insured versus uninsured. So if you're over 50 and insured in this province, you've got a 95.8% chance of being fully vaccinated. Now, it is the uninsured group, which is 47.1%, and this is the group that is most at risk. So the Department of Health definitely has to put its efforts into this group. Now, as I said, there's a lot more in the slides, but maybe I should say the second last slide is to reach our target, we have to fully vaccinate 310,000 people in the over 50 cohort, and that's new people. We also need to vaccinate 683,961 people in the 18 to 49 cohort. And again, that would be new patients. So our targets are quite difficult. It's clear that we need to put in a lot of effort to get more people vaccinated. My last slide is really my conclusion slide, which is to say the following. There are a significant number of people in the 50+ group who have yet to receive a single dose. We have low vaccination uptake in the 18 to 49 group, despite the absence of limitations. And we could be targeting these individuals at workplaces or through mandatory vaccines, through mandatory vaccines. We have had a relatively slow uptake in the 12 to 19 groups. And my final comment is that with the identification of Omicron, boosters for all age cohorts, particularly the over 50s, is essential. I'll stop there, Rashid, and I'll hand it over to you.
Thank you, Doc. That's fantastic. And I appreciate that. And we'll continue to work with you to see how the tourism in all of its sectors can help you reach some of those targets and continue the good messaging around not vaccinating, but also keeping safe and following the basic rules. So thank you very much. We'll see if there are any questions. So please add any questions you have in the Q&A box. Paul, what a weekend to celebrate both your wedding anniversary and your birthday last night. Spending most of your time on the airport and on the phone with airlines, but I'll hand over to you to give us an update from an airline perspective. Thank you.
Thank you, Rashid. I think my slides are up, correct?
Perfect, visible.
Okay, thank you. Yeah, thank you, Rashid, and thank you, Minister, for all your support during the past few days. Also from the airlines, it's very well received, and they really thank all of you for being there and for assisting in passengers, giving them confidence and assisting them with their returns to hotels if necessary. What I will do is I will give a short airline overview. So this is the schedule that we know as from 9 o'clock this morning. But as was mentioned already, this is very fluid, so it changes constantly. So in the meantime, it might be that it has changed already. But for now, it will provide you a good overview of the schedule that is in place. Before I start, I'm from Cape Town Air Access. We are based at Westgrow. We are a team of 5 people. And basically, we were established in 2015 to improve the network for Cape Town Airport and also for the Western Cape. And the parties you see are involved in our initiative. So it's basically, besides Westgrow, it's the airports company, both Cape Town Airport as well as the headquarters based in Johannesburg, Western Cape Government, City of Cape Town Tourism, and South African Tourism. And then we also have support from the private sector. And you can see the names of the companies that are involved on the slide. Before we go into the current schedule, I wanted to share with you the recovery, how it looked. So in front of you, you see the domestic airlines, the domestic network that has grown very well over the past few months. Basically, all airlines are flying to Cape Town except Mango, but for the rest, the network is in place. So before COVID, we had 13 destinations you could fly to in South Africa, and that's currently still the case. And as you can see, both the capacity as well as the load factors have been doing quite well. And at the end, you can even see the update until the end of November. So domestic hasn't been affected, and we expect it won't be affected at least as long as we are in level 1. So for the domestic side, we are quite upbeat that it will stay as it is. So we'll keep all the 13 destinations out from Cape Town. So domestic won't change. Then, of course, international is a different story. So basically what you see here is the recovery from beginning of the year. So you can see when we ended the second wave, you could see basically in February, we were only at 7%. But as you can see from August onwards, more and more borders, more and more countries opened up for South Africa. And you could see that also in the international numbers. And we were really on a recovery path with October back to almost a third. And as you can see in November, it was looking very promising, close to 40%. And the outlook was really promising, with more and more airlines returning to Cape Town and mentioning to us that over the Christmas season, most of the flights were full. So indeed, what I will do now is share with you the latest information. So I will go through all the airlines that are operating at the moment and won't operate. So this is like, again, this is the information we have until 9 o'clock this morning. So it can change again. So for now, Air Botswana, they're flying twice a week. They're still operating their flights to Botswana, to Gaborone. Air France, this is in alphabetical order. Air France is restricted. They were supposed to fly 3 times a week. Operations are suspended, so there's no flight today. But it might be that they will return by the end of the week. But the French government hasn't given any indication as of yet. So a long-term overview on outlook from Air France can't be given. Airlink is of course operating, besides routes in South Africa, also regional routes, both to Botswana, Namibia and Zimbabwe. They are currently operating a normal schedule. They have 1 flight from Johannesburg going to Luanda. That's been cancelled, but for the rest, Airlink is keeping all their flights into the region. BA, I'm sure you're all quite curious on what's happening with BA. Currently not operating, but they will return probably today or tomorrow. But it's probably for a short time. They will bring back stranded passengers, mainly from the UK and from Ireland, and they will operate for at least a week or 10 days. And we expect after that the route to and from Cape Town will be cancelled. But BA will keep an operation to Johannesburg. But as you know, very strict quarantine rules for everybody that's returning, and outbound indeed. For now, it's only UK and Irish passengers that can take that flight. Edelweiss still flying, still operating, so they're bringing in passengers that want to come to South Africa, but the outbound is very restricted. So currently only Swiss nationals and Liechtenstein, which is of course a large number, they're only allowed to go out and back into the country, and Edelweiss is only operating 2 flights per week to Cape Town, to Zurich. Ethiopian operating 5 times a week, and they are operating, and they take passengers on board, and depends of course also on the restrictions are in place at the destination. But for now they are operating 5 flights a week, and we have the indication they will keep on doing that. Emirates Airlines, unfortunately, all flights cancelled. The route has been suspended until the end of the year, till 31st of December. So no flights to and from Dubai. Then on the regional side, we have Fly Namibia and Kenya Airways, both operating, of course, to Windhoek as well as to Nairobi. Those carriers are operating flights at the moment, so that won't change. The second slide with the routes and the routes update. KLM flying 6 times a week to Cape Town. For now, they will keep that number. Inbound, it's allowed to bring in passengers. Outbound is restricted, so currently only EU passengers can take that flight, no South African nationals. And indeed, if you go back to the Netherlands, for example, you have to go into a 10-day home quarantine. And if you arrive in the Netherlands and after 5 days you have a negative PCR test, you don't have to quarantine anymore. But the basic rule is currently 10 days. Germany, Lufthansa, they're flying 10 flights per week, 5 from Frankfurt, 5 from Munich. Also indicated to us they will keep on operating. No South African passengers are allowed, but for them it's not only German nationals and EU passengers, also other people can go on board and transfer via Frankfurt. German nationals have to home quarantine for 14 days. Qatar Airlines, restricted operations. They're flying still daily from Doha into Cape Town, and they are allowed to take passengers into Cape Town. But as you can see, outbound is restricted. So they're not allowed to take any passengers until at least 15 December. Rwanda Kigali route is not operating, suspended until further notice. Singapore Airlines, 1 flight per week out of Cape Town at the moment. Passengers only allowed from Singapore and permanent residence holders. TAC Angola is not operating at the moment, suspended operations. Turkish Airlines not operating at the moment, also suspended till further notice. Virgin Atlantic from the UK, we don't know as of yet, but I expect if we stay on the red list that they won't start operating. First flight was supposed to start operating on the 17th of December. We haven't received final confirmation as of yet. We expect that over the next few days. And the last one I wanted to mention, and at least that's some good news. United, of course, operated in 2019 a seasonal flight to Cape Town, and they have indicated to us that they will return on Thursday. So the first flight will arrive back from Newark, New York on Thursday at 6 o'clock. And they've mentioned to us that they will keep 3 flights per week. Only American nationals and Canadian nationals can go out, but they don't have to quarantine. So hopefully that will convince, that will keep US citizens on the radar that they will come to Cape Town in South Africa. So this is a short overview. Like I mentioned, it changes all the time. If you want to have an update, we publish the news on the Westcore website. And I suspect that the latest update will be on there from the end of today. And we'll keep you up to date with that information via the Westcore website. Thank you.
Thank you, Paul. I really appreciate it. Thanks for the update. You know, interestingly, I had an anecdotal call. I called Linda on from Travel Start this morning, and we have such an important season, as you all know. I think what was interesting is that most people are postponing, not entirely cancelling their December, January breaks. Importantly, Minister, we're expecting about 30,000 just on that one platform of Travel Start, about 30,000 flights coming in over December, Jan still. So if there's no further lockdown, we're still going to see many bums on beds and rooms occupied. So that's an important sign, and we'll continue to lobby, as Minister said earlier. So if you have any more questions, please fire away. I want to thank our colleagues from the Department of Health for answering some of them. Melvin, would you like to anecdotally just add to any of those? The people are asking, for example, about the medical insurance, and also this important question around when can you get your second jab? Would you like to just speak to that point?
Yeah, happy to. So, and Marianne, if you can come in about the technical definition of fully vaccinated, because there is a time lag after the second dose, and if you can. If you're happy to. So I've answered the questions, but just for everyone, in my presentation, I referred to insured versus uninsured, and that's relating to people with medical aid or medical insurance versus people without. In the Western Cape, 24.8% of people have medical insurance from the General Household Survey of 2017. In terms of getting your second, there's been a lot of discussion about boosters. So as of today, so the only people that are getting boosters at the moment in South Africa are the health workers. I've had a booster. I had a Johnson & Johnson vaccine, and I recently went for my booster. So I've had a booster. I've had a second Johnson & Johnson vaccine. We have not introduced boosters for anyone else, but we do expect to very soon introduce boosters. We are pushing for it. The Western Cape Department of Health is pushing for it. It's a National Department of Health decision, but there are enough Pfizer vaccines, and there is with Omicron coming in, there's definitely a push to get more people boosted. Other countries like the UK have already opened up boosting in response to Omicron to more age groups, and the US last week opened up boosting to everyone over 18 because their criteria was getting too confusing. In general, boosting is 6 months after the last dose of the primary regimen, and that's how people get boosted. Is there anything else you wanted me to cover, Rashid? I'm quite happy to.
I think you've addressed most of the other questions. I think this effort of continuing to drive vaccination, I think there's a sense out there that because of the unknown factor around whether vaccines are work on the new variant. I think it's important to note, you've mentioned to me before, that despite any of the new information we get, having a vaccine will still add value. It still protects you at various levels. Am I right?
No, absolutely. And you shared an anecdote in the beginning, so I'll share an anecdote. So I went to, well, must reveal my weaknesses here. I went to a Starbucks because I like going to coffee shops, and they had a sign outside that said, staff are fully vaccinated. And I can tell you how I felt, because I'm always aware of the dangers of going into an open environment or a commercial environment. And that made me more calm. So that's an anecdote. There's no doubt that the most effective tool we have right now is vaccinations, even if there's immune escape. A vaccine, the worst case scenarios still don't take you to 100% immune escape. So vaccines do protect you. And you can see that across the world. So really, vaccines remain our primary tool. And the one thing I would say about South Africa is, you looked at our numbers. The truth is, our numbers are not in keeping with the rest of the world. The UK, Israel, Canada, Italy, they have over 75% of their adult population vaccinated. The BRICS countries are actually in the 30s, and you saw the number that I put up there. We really have to do better with getting more of our adults, in fact, more of our entire population cohort that is eligible for vaccines vaccinated, and that's what we meant by those targets here.
All right, perfect. And is Professor with us still? Would you like to comment as requested, Prof? Are you available?
Sure. I did comment in the chat. So we consider, so to get full protection from the vaccine, for a Pfizer vaccine, it is 14 days after the second dose. And for a single dose Johnson & Johnson, it's 28 days after your single dose. In terms of the stats that we present, we actually count you as fully vaccinated from the day that you get that second dose. And the reason for that is just because you will become fully vaccinated with full protection in 14 days. There's nothing more that we have to do for you to be fully vaccinated at that point. So just from our targets point of view. But in fact, the full protection does take 14 days. And so that's why if people haven't had their second dose, we would urge you to do that as soon as possible, because we do want to get that protection before our case numbers really do start to surge. Yes. Johnson & Johnson's a little bit complicated. It is still considered a single dose as the primary dosing schedule, a single dose vaccine. And so the 28 days post that dose as being fully vaccinated remains the definition of fully vaccinated. But I think there is emerging evidence that for Johnson & Johnson, a second booster is going to be required. And we will see movement in this space in terms of other sectors and other people outside of health whose initial vaccine was a Johnson & Johnson. It hasn't happened yet, but I think that will be the direction that we're heading in to give optimal protection. I don't know if Dr. Woodley wants to come in there.
No,
yeah.
I actually, thanks, Marianne. I just wanted to add that it's the 30th of November, and we have also started giving not a booster, it's called an additional dose to certain what we call immunocompromised people. So if you fall into a particular category, you can get an additional dose, but this is not the booster dose which we've been talking about up to this point. That's for those of you who have family members or who are yourselves fall into this category of being immunocompromised. You can get an additional dose right now.
Prof, can I ask you one more question? I think when will we know, how long do you think it will take before the experts and the powers that be could tell us whether the vaccines we have are effective? It seems like that's quite, I know it's the $1 million question, but is it 2 more weeks we're going to have to wait until that comes out? Or is it a week, or is it a month?
I think we could know pretty quickly. I would say around 2 to 3 weeks. What is critical to do that is for the health insurers and ourselves as the Western Cape Department of Health and the NICD to put the mechanisms in place to link all the vaccine data to all the infection and case data. And there is a lot of movement happening in that space at the moment. The analyses are complex to run, and obviously we do need to accumulate some cases and some severe cases so that we can actually see the effect of the vaccines. but that is happening in Gauteng at the moment. So the data should be able to show us. And the I suppose the good part is that the groups that have that would be able to do this have done this before. So Discovery has already looked at Pfizer effectiveness before the emergence of Omicron, and we've already analyzed the Johnson & Johnson data in the health workers. So the kind of technical skills to do these analyses are in place.
Okay, cool. Prof, can I ask you one more question? Are we at a place where we can track specifically unvaccinated hospitalizations or deaths versus vaccinated individuals?
No, we aren't, because the data at the moment isn't all linked fully. So we have vaccination data up until the end of September, but the data is not fully linked, and we do need to figure out a way to get that data linked so that we can do that. The NICD and the National Vaccine Registration System are also working to try to link that data so that we can do that. Obviously, you can ask people about their vaccination status, but that's not nearly as reliable. And also, when someone's very sick in hospital, it can be quite difficult to ask about that. I don't know, Dr. Moodley, if you want to come in here.
Yeah, thanks, Marianne. So Marianne's very modest, but many of the very compelling graphics on deaths and hospitalizations and deaths in the vaccinated and unvaccinated are actually done by herself, and adding the graphic designer skills to your skill set, Marianne. I think, Rashid, there's so Omicron, let's leave Omicron for this to the side. There are tons of research that shows that if you are fully vaccinated, you are at much lower risk of hospitalization and death. I mean, I can pick one study in the US that shows if you are not fully vaccinated, you've got an 11 times higher chance of hospitalization and a 10 times higher chance of death. Similarly, we've shown in the Western Cape, if you are fully vaccinated, you can prevent numerous deaths in the older cohort. So there's no doubt that being vaccinated offers protection against severe illness and death, particularly severe illness and death. You asked the million-dollar question, which is, you know, that how does Omicron, do the vaccines work for Omicron? That's what everyone wants to know, because if we're vaccinated, we feel we have a degree of protection. And I think we have to be patient with this. You know, we can be hopeful and say it should have some protection, and we remain hopeful that it will have good protection against severe illness and death, but we have to wait for those data.
Thank you. Thank you very much for those insightful inputs. And thank you. Ilse, can I go to you briefly, just to pivot before we close to some of the important issues we're dealing with from a domestic, I think domestic tourism is almost going to be our savior as we see a drop in international. But do you want to say a few comments before I hand over to the HOD to close?
Not a problem. Thank you, Rashid. And it's lovely seeing all the tourism people on the call. So this is a specific briefing for the tourism industry. And I just wanted to add that we'll continue our lobbying efforts, and you would have seen in the news and on the media specifically, there's a very big, strong push from national government in relation to having those discussions with these particular countries who've placed us on the various long list of travel bans. And as Professor Davies and Malvin have indicated, there's definitely been, as the data will become available, hopefully this will de-escalate, but again, we have to wait and see in terms of what the results will be. But our lobbying efforts in terms of the travel bans is definitely ongoing, and if not just escalating in terms of the priority from the president and our minister in terms of their agenda. And then just to continue, we've been starting to prep with regards to destination readiness ahead of the summer season. So I please just want to have a strong plea with our tourism industry role players to continue with our health and safety protocols that are in place, because our biggest message that we need to put out there is in terms of that the Western Cape and South Africa is there's a degree of safety in terms of we've got the protocols in place, and we want to encourage all visitors, whether you're international and domestic, to visit our beautiful country and province. And in particular, as we've had to pivot again and value that domestic traveler for the summer season that's has kicked off, but mostly from December onwards. So I just want to put that on the table. Thanks, Rashid.
Thank you, Ilse. And I want to ask any partners out there, hotels, tour operators, if there's anything you need from us, if you'd like to partner with us, if there's anything we've shown in the last, throughout COVID, but specifically again in the last 4 days, is the importance of us working together. So there's a certain power of us collaborating, either on a marketing campaign or even on a reputation management campaign. We look forward to partnering with each of our sector bodies and with individual businesses, if you wish. So I just want to thank you once again, everybody, for being here. And I'm going to hand over to HOD Fourie to make some closing remarks. Over to you, Sally. Is the HOD with us? And I'm not sure if I see him now. He may have dropped off. Am I correct? Aha. So HOD seems to have dropped off, and so we really are wrapped. I think we've answered everybody's questions. Minister, would you like to say any closing remarks? I want to thank you again for just literally getting your hands dirty, getting out there, taking people. I have this image of Minister taking somebody out of the line saying, do you have your test? Have you done your PCR test? And then taking them down and helping them and watching them get on the plane. But Minister, would you like to say any final remarks before we close? I'm not seeing anybody. Can everybody else still hear me?
Yes, Rashid.
So it's not me that's gone offline. So folks, I want to thank everybody. I think let's close there then. And thank you all. Just reminding you that on Thursday afternoon, we will be having another more general business briefing. And you're all welcome to attend. Dr. Keith Clutie will be giving an update because this is in a continually evolving situation, and continue to speak about our efforts to get people of the Western Cape vaccinated and safe. So thank you all for being here today. Thank you for all the panelists, and be safe out there, guys, and have a good season. In spite of all this, keep doing what you're doing. Take care. Bye-bye. Signing out.